Professor Pallas here with the Week 2 wrap-up for NTD 420. This week, we learned about the prevalence and distribution of obesity. It's very important to recognize that worldwide, obesity has tripled since 1975. There are also social variables, including income, that we can correlate to obesity. The medical care costs associated with obesity are important to be aware of. The actual numbers may change, but it's important for you to recognize that there are increased costs for care related to obesity. According to the most recent data, adult obesity rates now exceed 35% in 7 states, exceed 30% in 29 states, and exceed 25% in 48 states. So where does Pennsylvania fit in this? Pennsylvania currently has the 24th highest adult obesity rate in the nation and the 14th highest obesity rate for youth aged 10 to 17. Pennsylvania's adult obesity rate is currently 31.6%. This is up 20.3% from year 2000 and up 13.7% from year 1990. In addition to learning about obesity statistics and prevalence, this week we started to discuss the basics of a nutrition assessment. Registered dietitians prepare nutrition assessments to evaluate for an imbalance in nutrition, which is called malnutrition. Remember that overnutrition and undernutrition are both types of malnutrition. Overall health, general health, depends on physical, mental, and social well-being. This includes good nutrition. When a dietitian performs a nutrition assessment, they typically use the ABCDE method. A is for anthropometrics, B, biochemicals, C is for clinical, D is for dietary, and E is for the environment. I want to take a minute here and quickly review the elements of the clinical assessment, and I'm doing this because of the results from the weekly class survey. I think some of you might benefit from reviewing this. So during the clinical assessment, the registered dietitian is basically looking at general appearance and behavior. Does this person appear short for their age? Do they appear underweight? Do they report that they're easily fatigued? Are they listless? Are they nervous, irritable? Do they report insomnia, poor work capacity? Looking at them at their physical appearance, does the hair appear more thin and sparse than it should be for a person of this age? Looking at their face, do you see any signs of malnutrition in the face? Typically, we look at the temple to see if there are any signs of concavity there. A concave area around the temple can be a sign of poor hydration. Looking at the eyes, looking at the lips, do you see dry skin? Do you see dry eyes? Looking at the tongue, does the tongue have any unusual characteristics, any unusual color, shape? Looking, if you can see into their mouth further, looking at their gums of their teeth. You can also look at their nails. Based on what they're wearing, you may be able to see some muscle tone in their arms. And basically, the key thing to remember for the clinical assessment is that these are physical characteristics that you are able to observe in the person. So when you think about a nutrition assessment, this is more than just a report of what the person is eating. It's going to include all of those elements, the A, the B, the C, the D, and the E. B is biochemicals, and those are typically available to registered dietitians. That's one of the marks of distinction between a registered dietitian and somebody who is simply billing themselves as a nutritionist. So remember, a nutrition assessment is more than just a snapshot of what someone has been eating. So let's take a look at the results of our weekly class survey. Remember, these are opinion-based, so there's not a right or a wrong answer, but it is interesting to see what your opinion was in relation to your peers in class. So the question was, which of the 5 nutritional assessment measurements do you think you could best address with interventions when you're a practicing nutrition professional? 76% of the class selected a dietary. And that's a strong answer because diets are easy to address with people. Implementation and behavior change may be difficult, but selecting and suggesting dietary changes and improvements is an easy and appropriate intervention strategy for someone. 14% of the class selected environment. Now, this might not always be easy to address, but it is something that you could help people with. Sometimes people need to understand where they could go to exercise or what other venues exist for them to shop or where they might be able to get food if they qualify for programs like WIC or other forms of assistance. 10% of the class selected clinical assessment. That's why I took a moment there to review that slide so you could see what that looked like again. Now, if you were looking at that and thinking that you were advising a adolescent who appeared short for stature and you're reviewing their nutrition and you're identifying they're not eating enough, that could be an appropriate way to use the clinical assessment as something you are going to address. Or if you notice that they are malnourished and that they appear dehydrated, that's another great time to use the clinical assessment for what you would address. None of you selected anthropometrics. So it's important to remember that this includes weight. Anthropometrics include a person's weight. And when you're preparing an intervention for someone, setting a weight goal can be very appropriate. A weight goal might be a goal for gradual loss. It could be a goal for gradual gain. It could be a goal for weight stability, or it could be a goal to stop gaining weight if someone's been on a trajectory where they've been gaining weight consistently for months or years. So keep that in mind. Anthropometric goals can be good goals when you're designing your interventions. Also, none of you selected the biochemical assessment. And remember, registered dietitians will have access to biochemical data, and this could be really important if you're counseling someone who has type 2 diabetes. You will be reviewing their hemoglobin A1C, their HA1C, and you could set an HA1C goal for someone. Another example of the use of biochemical data to set an intervention would be when you're counseling someone who has high blood pressure, and you might be recommending that they go on the DASH diet. Another biochemical that we typically see in nutrition is cholesterol. So these are the results of the weekly survey. Thank you all for participating. There's one every week. As we enter week 3, let's take a look at what we have coming up for due dates. Remember that assignments and quizzes are always due Sundays by 11:59 p.m. This week, you do not have a quiz. You have a group discussion assignment this week. This is the first time you will be doing peer responses. Your initial post is due Wednesday night by 11:59 p.m. And then you will submit 2 peer responses to group members, and these will be due by Sunday night at 11:59 p.m. I did send an announcement out over the weekend with some advice on writing strong discussion posts, and I encourage you to pay attention to APA writing style and citing style. You should be including references, and you should be writing in APA format and style. So my best advice at this point, keep up to date with the readings and watching the assigned videos and presentations. Please complete the weekly survey and participate in the group discussion. I would also recommend that you could start studying for quiz 1. This quiz opens on February 10th, and it's due by Sunday, February 16th at 11:59 p.m. Thank you so much for your time.